The image quality has been excellent. It's very crisp and clean, and definitely in comparison to the previous older ultrasound we were using, it's been night and day. I'm an obstetrician gynecologist here in Vancouver. I see primary care as well as high-risk obstetrics in my practice, as well as full-scope gynecology. And I also spend some of my time in a specialty clinic focusing on lower genital tract diseases. Ultrasound is very useful, particularly in obstetrics, in regards to providing real-time information that helps with clinical decision-making. It can be useful in alleviating patient concerns or guiding clinical decision-making. For the gynae patients, there's a few uses. So IUD localization, so directly after IUD insertion, you can confirm, or if patients having some struggles with their IUD, bleeding, cramping, where they can't find the strings, again, you can confirm IUD position. You could also have a look at the ovaries to see if there's a cyst on the ovaries, for example, with a scanner. The ultrasound that we've previously had in the office was a cart-based system. It was a little bit onerous actually to have to wheel it into the room, so oftentimes that would be a barrier to using it because you're adding a lot of time to the appointments. So we were looking for a new ultrasound and we were very impressed with the Clarius, so we transitioned to that. The handheld ultrasound really has simplified the ability to use the scanner, so it is easy to connect, it's so portable, so I find that I'm using it more often because it seamlessly fits in as almost as an extension of the physical exam. Because it's so small, I'm able to often carry it with me. It connects really easily to the iPad or even a phone if you're using it. So I find that I'm just carrying it with me between visits. It's easy to clean, and then if I need it, I just can seamlessly connect and do a scan. Handheld ultrasound has really made it more accessible, whereas previously the standalone machines were not portable, or even the machines that we had were quite large and difficult to transport even between rooms. So this has made it more available for all of us to use. I've actually found it to be quite intuitive. Without even reading any manuals, I've been able to just sort of explore around with the touch screen, and I find that most of the time I'm able to find what I'm looking for without much trouble. So it's been nice in that sense, not to have to spend time figuring out the logistics of working the ultrasound scanner. There are certain times where I would routinely use it for every patient. For example, at about 35, 36 weeks, I would routinely check their position. And then there's other indications where I would use it. So for first trimester bleeding, or to check the fetal heart before the doctor can hear it, and to check fetal position, IUD positions, for example. I think it improves patient care in a few ways. It helps alleviate patient anxiety. You can show patients real-time images and reassure them. It also allows you to expedite patients' care based on your images and your scanning. And I think it also helps with our own confidence in decision-making. They love it. So they can actually see the images in real time. Often they'll like to have a little look at the baby's face. It helps expedite their care. For example, 36 weeks, if we're not sure the position of the baby, we can confirm whether it's head down. If it's not, we can expedite management for that. Also, in many cases, it helps to alleviate their anxiety. So if they come in and they're worried about something, and we can scan and reassure them really quickly.